Hi everyone, welcome back. Today we're diving into some startling data about a drug you've definitely heard about, semaglutide. Brands include Ozempic and Wegovy. Widely promoted for weight loss and diabetes, it's become a huge player in health discussions. But behind the success stories lies a serious question. According to the UK regulator Medicines and Healthcare Products Regulatory Agency, MHRA, 29 deaths are linked to semaglutide in their reporting scheme as of January 2025. The Times of India +1. What does that number really mean? Is it proof of danger, or just a signal that raises questions? In this video, we'll explore why these 29 reports matter, what they don't tell us, and how you should interpret them if you're thinking of using the drug. This video is for educational purposes only. Always discuss any medication with your doctor. Let's begin. Understanding the UK data. When we hear 29 deaths linked to semaglutide, it shocks us. But let's look closer. The MHRA's data is drawn from their yellow card scheme, a system where patients or healthcare professionals report suspected adverse drug reactions. UK Parliament. Here's what to keep in mind. Is the number of reports with a fatal outcome where semaglutide was used, not necessarily the number of confirmed causal deaths. Of those 29, 4 were cases where semaglutide was used for weight management, rather than diabetes. Q&A files +11. The total number of deaths reported for the broader class of GLP-1 receptor agonists, GLP-1RAs, was 82, up to January 2025. The Daily Guardian. So the number alone is eye-catching, but it doesn't mean the drug definitely caused each death. Underlying conditions, other drugs, or other factors might be involved. The MHRA explicitly notes this. UK Parliament. What this data does show us is an emerging pattern. As the use of semaglutide grows, so do the number of serious reports. Understanding it means knowing both what's behind the number and what's missing. So why are regulators raising the red flag now? A few reasons. Usage of semaglutide and other GLP-1 drugs has skyrocketed for weight loss, diabetes, off-label use. Higher use, higher chance of rare events showing up. A parallel issue. There's been a surge in unlicensed or counterfeit versions, especially for weight loss use. The MHRA seized 369 suspect Ozempic pens in the UK alone. Jove, UK +1. Some fatalities and hospitalizations have stemmed from those fake or off-label products, not always the approved dose or form. Side effects that were once rare are now reported more often. Egersound pancreatitis, gallbladder disease, severe gastrointestinal events. All of this means we're not just looking at a static safety profile. We're looking at a drug in the spotlight, with usage changing fast, which means risk profiles may shift too. Let's get clear about real risks associated with semaglutide and its class. These are documented, though rare. Pancreatitis by gallbladder problems. Reports in the UK mention nearly 400 cases of acute pancreatitis linked to GLP-1RAs. 22 were for semaglutide alone. The Guardian +1 fake or off-label products. Some deaths/hospitalizations were tied to injections obtained online without medical oversight, potentially containing insulin or incorrect drugs. The Pharmaceutical Journal +1. Hypoglycemia and AMP, organ stress, especially when used with other glucose-lowering drugs, or in people with kidney or organ impairment. Rebound weight or metabolic effects. When people stop the drug suddenly, weight often returns quickly, and metabolic stress increases. One crucial thing, the MHRA has not established that semaglutide causes suicidal thoughts or self-harm behavior. Gov. UK. So, the risks are real but nuanced. Rare doesn't mean impossible, and that's why awareness matters. If you or someone you know is using or considering semaglutide, these are some higher risk situations to watch for. Existing pancreatic disease, gallbladder issues, or kidney dysfunction. These organs are implicated in some severe reports. Patients using the drug without medical supervision, especially those buying online or getting compounded versions. High-dose usage or off-label use for weight loss without adequate follow-up. People combining semaglutide with other medications that affect blood sugar, digestion, or organ function. Rapid weight loss in short time. The body may struggle to adapt, increasing risks. If you're in one or more of these groups, it doesn't mean you mustn't use the drug, but it does mean enhanced monitoring and caution are essential. The 29 deaths, what they don't tell us. We've covered what the 29 death number is, but now let's look at what it doesn't show. It doesn't confirm that semaglutide caused all or any specific death. These are reports of suspicion, not confirmed causation. UK Parliament, it doesn't tell us the rate, how many people took semaglutide compared to how many deaths. Without that denominator, we can't know the true risk per user. It doesn't include a full breakdown of dose, duration, underlying conditions, or other drugs used concurrently. Many people using semaglutide have other major health issues, obesity, diabetes, cardiovascular disease, which themselves carry increased mortality risk. So, the number is alarming, yes, but we must interpret it with context, not fear. It's a warning sign, not a verdict. If you're using or being prescribed semaglutide, here are 5 questions to ask your healthcare provider. What is my indication? Weight loss versus diabetes? And how does semaglutide fit it? What organ checks? Pancreas, gallbladder, kidneys will we do, and how often? Are there any other medications I take that might increase my risk? What happens if I stop the drug? What's the plan for safe discontinuation? How will we monitor and report any serious side effects, and I mean report? Remember, increased risk doesn't mean inevitable risk, but managing risk means asking the right questions. DEG. Balancing benefits. An AMP. Risks. Finally, let's balance the picture. Despite the 29 death reports, semaglutide also has very strong proven benefits. Improved weight loss, better control of blood sugar, and even reduced cardiovascular risk in some large trials. Gov. UK used correctly. Under medical supervision, the benefits for many can outweigh risks. But the margin is often smaller than we assume. Rapid uptake, off-label use, online purchases, and social media hype have complicated the safety profile. So the real message isn't avoid the drug, it's use it wisely, under supervision. If you're using semaglutide, stay vigilant, stay informed, ask questions. Your safety depends on it. So, to wrap up, the MHRA data shows there are 29 reported deaths linked to semaglutide. Significant, but not definitive proof of causation. The numbers raise serious questions about safety, especially with increasing off-label and unsupervised use. If you're using or considering semaglutide, talk openly with your doctor, understand your risks, and monitor carefully. If this video helped clarify things for you, please give it a thumbs up, subscribe for more in-depth medical breakdowns, and share it with someone who needs the clarity. Stay informed, stay safe, and remember, the power of a drug is in how it's used, not just what it promises. Thanks for watching.